The seventh order of the day is a motion on urgent need to develop a national plan on sickle cell, standing in the name of Honorable Saheed Akinade Fijabi. Honorable Fijabi is now invited to move the motion.
My name is Saheed Akinade Fijabi. I represent Ibadan Southwest Northwest Federal Constituency. I rise to move a motion of urgent need to develop a national plan on sickle cell in Nigeria. The House knows that sickle cell disease is a disorder of the blood caused by inherited abnormal hemoglobin, the oxygen-carrying protein within the red blood cell. Within Nigeria, reportedly have 5 million sickle cell patients. Also note that the disease is mostly common in developing and underdeveloped countries across the world, as most developed countries do not have any case of these diseases. Concerned that in Nigeria, the high rate of illiteracy, especially in the rural communities, little is known about the disease, and this has resulted in numbers of sickle cell anemia patients in the country and other African countries. Aware that in Lagos, there is a Sickle Cell Foundation of Nigeria, which was established for the purpose of educating the public on the disease and assisting patients where necessary. However, the scarcity of funds has hindered its operation. Also aware that successful treatment of this disease was carried out at the University College Hospital in Ibadan through a bone marrow transplant, and process was said to be less risky. Mindful of the fact that more still needs to be done in terms of educating, orientating the public on the disease, and areas of subsidizing the cost of treatment, as some families could not afford the cost of the money. The House will resolve to mandate the Committee on House Care Service to interface with relevant government agencies to engage in continuous campaigns and education of public on the disease. Number two, urge the federal government to introduce a policy for subsidizing the cost of treating patients with sickle cell anemia. I so move, Honorable Speaker. Thank you.
Honorable Barrister Evelyn Omabonwa Oboro is my name. Representing Okbe Sable Uwe Federal Constituency and from Delta State. I rise to second the motion ably moved by my colleague. I so second. Thank you.
Mr. Speaker, honorable colleagues, we should understand or remember or take note that 19th of June is a sickle cell date in all over the world, and I believe Nigerians also should join in celebrating it. Mr. Speaker, sickle cell disease is a major genetic disease in most countries in sub-Saharan Africa. It's a genetic blood disorder that affects the hemoglobin within the red blood cell. The recurrent pains and complications caused by this disease can interface with aspects of the patient's life, including education, employment, and physiosocial development of the patient. Nigeria, as noted, has the largest population of the people with sickle cell disease in the world, with over 150 babies born with serious condition every other year. And also research have shown that estimated about 5% of the child with sickle cell disease live in Nigeria, live past the age of 10 in Nigeria, compared to other countries of the world, which have over 96% survival into adulthood. Mr. Speaker, honorable colleagues, going forward, I believe what needs to be done in solving the problem or trying to prevent the disease is just creation or strengthening of national sickle cell disease control program within the framework of national programs for prevention and control of non-communicable disease, which is obviously necessary in the country. The essential areas of work should cover advocacy, prevention, treatment and data collection, surveillance and research, and community education, and partnering with non-governmental organizations, NGOs, like the one in Lagos. Mr. Speaker, before I sit down, I want us to remember there is a notable case of the death of the daughter of our present President, Suleya Buhari, who died of this case sometime 3 years ago. So I think it's time now for us to see and find a way of finding lasting solution to this problem. This problem is only very common within ourselves in most especially sub-Saharan Africa, as we have said. So, Mr. Speaker, honorable colleagues, now the first thing we can do is the prevention and the treatment. It's about bone marrow, which obviously is being done in India, and now the practice is being carried out in University of Ibadan, just close to us here. Mr. Speaker, honorable colleagues, I employ us to support this motion. Thank you, Mr. Speaker.
Honorable Keita.